Good afternoon, and thank you for everyone for being here today. I know we have a lot of interest in today's announcements, and I just want everyone across the state to know that we have approached this in a manner in which we believe that we are doing what is in the best interest of our state and what we believe to be in the best interest of school children throughout Mississippi. We know that we are facing two crises in this state as we tackle the question of how to reopen schools safely. The two questions that are before us: how do we prevent rampant community spread of COVID-19? And number two, how do we prevent the lifelong damage of extended school closures for our children? As Dr. Redfield said the other day, the question that is before us is public health versus public health. Both of these questions are extremely serious. Our office has been flooded with calls from teachers who are not ready to return to work. Those come right alongside calls from countless single moms sobbing into the telephone, about to lose their ability to provide for their child if they cannot get them back in school. None of this is simple. As I read through the 598 pages of school reopening plans this weekend, that's 10 pages of summary and 588 pages of reopening plans, I was struck by a few things. There are some who have presented the choice before us as chaos versus a blanket mandate. In my view, that is simply not the case. Overwhelmingly, schools are working hard to provide for a safe return. Every school had some contingencies for virtual learning, which we know will be at least part of the equation this year. Understand that our decision here today is the beginning of the conversation. It is not the end of the conversation. We know that 2020, 2021 is going to be the most challenging year we have faced. Every school had contingencies for virtual learning, which we know will be part of the equation. Let me say that again. We know that virtual learning will be part of the equation this year. All 144 districts have aggressive sanitation plans for classroom and common areas. All of them are working to socially distance their schools. For example, 132 of the 144 districts are providing meals only in classrooms to prevent kids from gathering together in the cafeteria. 71 districts provided detailed plans for a hybrid schedule where students would rotate between in-person learning and virtual education to provide for fewer children in the classroom. When you look at the guidelines that have been provided by both the CDC and the State Department of Health, it is critically important that the simple concepts that we have been referring to over the last 6 months in these briefings apply to our schools as well. We need to wear a mask. We need to properly socially distance. We need to make sure that we look out for ourselves and we look out for our neighbors. We also know, in looking at these plans, that there are 51 districts that plan to start sometime this week. There are 49 school districts that plan to start sometime next week. There are 14 school districts currently slated to start sometime the week of August 17th. There are approximately 23 school districts that are scheduled to start after that date. Obviously, there has been a lot of time, effort, and I believe thought put into each of these plans. Some of them, I would argue, are better plans than others, but they have all been thought about. They've all had local input. And I want you to know that there is a reason that we have elected school boards, superintendents, and an entire structure to make those local districts have decision-making power for their local schools. They are the most familiar with their staff, with their resources, and with their student populations. They have relationships with the teachers and the parents. There is no option before us without risk. But after reading their plans, I feel comfortable in this decision. Whenever possible, I will allow local school leaders to determine the best plan for their local schools. Those closest to the classroom will be best equipped to make those decisions. We have guidelines in place for schools from the Department of Health to guide their reopenings. They include staggered schedules where every household has the option for virtual learning. They include limits on class size, and even a delay of in-person class for teens and preteens as we start to see positive signs of moderation in community spread. All of those make sense to me, and I would urge every district leader to work them into your plans. Of course, each of those will have to be individually tailored as our schools are not uniform. But they represent the best possible wisdom that our health experts have to offer to mitigate the spread of COVID-19. One part of those guidelines offered by the State Department of Health is the requirement that all students and all staff wear masks while in school. We have seen over the last several weeks that when people participate and wear masks, it helps. We are seeing improvements in our numbers, albeit much slower than any of us would like for it to be, throughout our state. And I am convinced it is because we are seeing more participation by individuals in wearing masks. In fact, everyone I see in this room today, here in Hinds County, is wearing a mask. It makes a difference. I believe when we talk about masks in our schools, that is a universal floor that I feel strongly about setting. It will allow for a far safer environment for education. Today, I will sign an executive order that requires the use of masks by all adults and all children in our schools, unless there is a medical reason not to. We also need to remember the actual warnings of public health experts. The CDC says that the public health risk of extended school closures outweigh the public health risk of opening them. They are very concerned about the lack of nutrition, the lack of care, and the lack of supervision of kids across America. And I want everyone watching here today to know that I am very concerned about the lack of feeding, the lack of care, and the lack of supervision for our kids throughout Mississippi. Our kids face, in many instances without a stable home life, real challenges. In this entire 7 months that we've been dealing with this virus, we've talked a lot about essential versus non-essential activities. If there is anything essential in this world, it is our schools. We also know that teenagers can be effective spreaders of this virus, and we need to work to get our overall transmission rates down. To that end, based upon the data that is before us, I will also sign an executive order today to delay the start of the academic year for grades 7 through 12 in a handful of counties. There are a handful of counties that certainly reach that threshold of being hotspots. For this standard, we are mandating a delay in counties with more than an absolute number of 200 cases and 500 per 100,000 residents in the last 2 weeks. We must pump the brakes in hardest hit areas. The counties that meet those criteria are Bolivar, Coahoma, Forest, George, Hinds, Panola, Sunflower, and Washington. I'm going to reread those counties because this executive order, which delays the start date, is only for those counties. Bolivar, Coahoma, Forest, George, Hinds, Panola, Sunflower, and Washington counties. Every leading indicator that we have says that we are starting to see improvement in our state. Every leading indicator says that we are starting to turn a corner. Things are improving here. But that does not mean that we can declare victory and take a step back. In fact, it means exactly the opposite. It means we have to press our advantage. We have to take advantage of the fact that the curve may be turning over, and we must come together to beat this virus back. With that in mind, I also intend to sign an executive order today to require masks in public gatherings and retail environments statewide. I believe in my heart that we've got to get our kids back in school. I know that I want to see college football in the fall. The best way for that to occur is for us all to recognize that wearing a mask, as irritating as it can be, and I promise you I hate it more than anybody watching today, it is critical. If you wear a mask, if you socially distance, if we do the little things, it will make a difference. And therefore, I am implementing a statewide mask mandate today. Up to this point, we've kept the focus for masks on the counties with the highest spread. Now, with a 2-week push, I believe we can have the maximum effect and allow for our education for our kids to occur. I have taken a piecemeal approach. I've been criticized by it by an awful lot of people. But I've taken a piecemeal approach because I believe firmly that that was the best way to get the most number of people to participate. Admittedly, it took a few days, maybe even a week. But if you travel around in those 37 counties that currently have mask mandates, participation is far greater today than at any time during 2020. Our people, by and large, are rule followers. Our people almost exclusively have very big hearts. Nobody wants to get the virus and give it to their mom or grandmom and see them suffer in a hospital and perhaps even for the rest of their life. Everything that we have done has been about getting the most possible cooperation from the people of this great state. And I believe that there is enough motivation to safely get our kids in school that we can really juice participation of mask wearing throughout our state for the next 2 weeks. These are hard times. And hard times call for hard truth. We cannot and we will not prevent every person from contracting COVID-19, whether children are in school or whether children are out of school. And sadly, we cannot prevent all damage from this pandemic to our children's education and thus to our children's future. I've had an occasion to speak to leaders all across the country over the last several months, including Vice President Pence on Saturday. We know that great harm has already occurred across this country, and there will be more children who fall behind. I firmly believe that we must limit the risk in both directions. Throughout this pandemic, we've tried to operate with humility, understanding that we cannot be too proud to change course. We know that with this virus, times change every single day. The data changes, the situation changes, and we've got to be prepared to change as well. This is what I believe is the best plan for the initial reopening of our schools. Dr. Dobbs and our health experts have worked with us on this. We will continuously measure and assess the situation. Here's the bottom line. We have to balance the very real risk of the virus and the lifelong damage of school closures. To do that, we have to safely provide education for the greatest possible number of children. In my opinion, the best way to accomplish that is to provide guidelines, allow local school leaders to tailor them, and step in with the authority of state government if and when and where it is absolutely necessary. That is what we are doing today. This is the beginning of that effort. It is not the end. We will continue to provide resources throughout this state. We will continue to provide PPE and money and guidelines and guidance. And most importantly, we will continue to pray for everyone in this great state. Dr. Dobbs, please give us an update on the numbers today.
Thank you very much, Governor. Today we are reporting 1,074 new cases of coronavirus and sadly 42 additional deaths. If we look at our trends, we're hoping that we're seeing a bit of a plateauing of the number of cases, especially if you look at the date of onset. Make sure we look at that. That's a lot more telling about where we're going. But certainly we don't want to be too complacent because we do see these variabilities from time to time, so we need to monitor it closely over the next few days to see if this is a plateau. If we look at our hospital utilization, we continue to have significant stress in the hospital system. We have the most ICU patients that we've had to date at 314, 173 on mechanical ventilators, 963 in the hospital altogether. So some potential leveling on the total number of hospitalized patients, but still we're seeing a lot of stress within the healthcare system. We do maintain regular communications with them, and we understand they're under significant strain. So please stay safe and try to prevent the spread of coronavirus for everyone's sake. If we look at the school situation, we are monitoring closely the situation in Alcorn County and Corinth, where they have had several cases. Thus far, we've identified 6 students who have coronavirus. We're working closely with them to identify who those contacts are. We are working to test all of those contacts, and we're also working to understand what are the risks of transmission within that environment. The Corinth School District has done a fantastic job of planning, which has been very wonderful. I think it could be a real model for looking how do you do things safely and also understand how do you trace these students after an exposure. So this is a wonderful opportunity for us to work with them and learn for future exposures, because without a doubt, we're going to have every school that opens is going to have some child, some teenager with coronavirus walking through the door. Just based on the law of averages, we're going to see that. We've been working closely with colleges. Colleges have an entirely different scenario. We are not recommending at this time that they delay opening. We have other recommendations for them. Most of their risk is going to be outside of the classroom. It's going to be in the bars. It's going to be in the social events where we see them spreading coronavirus. So we're working very closely with them, and we'll try to do everything we can to minimize transmission on the college campuses. Would like to reiterate how important it is for people to avoid social events for the next few weeks especially, but really throughout a lot of this pandemic response. If we can all just chill out for about 2 or 3 weeks, consistent with the mask mandate, and just not go to a party, don't go to a shower, send your regrets to the wedding. I mean, a lot of these cases that we're seeing are linked to social events. We are undermining our ability to start school and to keep businesses open because we want to have dinner with our friends who are in from out of town. We're seeing this over and over and over again. So please, just for a few weeks especially, let's just relax and not do unnecessary social events and not spread coronavirus, especially our young kids. And if you're a teenager, let's just chill out for a couple weeks, almost a soft quarantine before school starts if we can, so that we know that our kids are least likely to go into the school with coronavirus. A couple of other things going on. We're very excited about the project in Lexington, Mississippi. We're partnering with CDC to try to offer testing to every single individual who lives in Lexington. And the goal of this effort, we'll see if we can encompass that community, offer testing to everyone, do immediate or rapid test turnaround, immediate case investigation, contact tracing, then testing those contacts, and then a test again in a couple of weeks, hopefully. Trying to see if we can do this sort of intensive intervention and really, from a hotspot perspective, stop transmission in its tracks. We're excited about this project. It actually was suggested to me by Dr. Redfield a couple of weeks ago. They were really excited about it too, so look for more information on that front. The last thing I want to mention is we did issue a public health order today that outlines mandatory isolation for people who have coronavirus. And the reason that we're doing this now is we are unable to contact every new case of coronavirus for a variety of reasons. Some of it is the growing use of rapid testing and the lack of reporting to us. We're finding more and more that we do not get all the reports of positive cases. Part of it is the delay in reporting by clinics and also laboratories, some of them. Most are doing a fantastic job, but a significant minority are not getting this information to us. And the third thing is the total number of cases is overwhelming our system such that we cannot do timely, individualized isolation orders. We're working with physicians and we're working on other mechanisms to make sure everyone understands what are those critical elements of isolation. And I would like to make a final or just an additional sort of plea, and we'll be working on this more, is if you're a medical clinic and you're doing rapid testing for coronavirus, you must report your cases to us. It is undermining the public health effort. I know it's another step you have to do, and I've heard people complain that they're too busy to do it, but it is legally mandated to report positive coronavirus cases no matter how you diagnose them. And that's all I have, Governor. Thank you.
Thank you very much, Dr. Dobbs. We also have Director Michelle with us today, who leads our emergency management effort, and him and his team have done a fantastic job. Director Michelle.
Thank you, Governor. Good afternoon, everyone. As you recall from the last press conference yesterday, kicked off the COVID-19 emergency relief program for counties, for Mississippi counties and municipalities as well. Our call center started at 9 o'clock on Monday morning, and it runs daily, Monday through Friday, till 3 o'clock. I want to remind everyone of the number. I will at the end, but I want to give a brief here real quick on what we've done. We received approximately 200 calls into that call center for assistance, and then we have also received, on the CARES Act side of the house, approximately 55 submissions. Of those 55, 24 have already been approved to be able to work through the process, but the majority of those have been denied, and this is really what I want to hammer home. Those that were denied were all submissions that were sent in from private businesses or private citizens. Just a reminder to everyone, this relief fund is for counties and municipality applications only. If you're a private business or citizens, this program is not for you, so you're probably going to get turned around or directed to another source for whatever your problem may be. For PA submissions, we received approximately 339 applications from counties and municipalities through the FEMA grants portal, and we continue to work those. So we're, Governor, on track right now in processing those based on the legislation and what we were directed to do. A reminder on the phone number, if you need assistance either for the PA or for the CARES Act portion of that phone number is 1-844-522-0000. 1-844-522-7367. Again, that number is 1-844-522-7367, and our bank of callers there will assist you in any way that they can. Just a note, and I don't want to talk about what could be considered a dark subject, but we've been monitoring a number of reports in the press from some coroners discussing about running out of space in their morgues. I would ask that coroners to please, if you have any resource requirements there or need assistance in helping managing your assets in your local municipalities, to please work those resource requests through your county emergency management director. If you are not familiar with your county emergency management director, there's a complete listing of emergency management directors on my website at www.msema.org. Complete list of resources. Please contact them. We've worked through a number of the issues already, and we'll help you any way that we can there. And then finally, to end on a positive note, just a tropical update. I have briefed you over the past couple of weeks about storms that have been out in the system potentially headed our way. I'm happy to report that there is nothing right now. Hurricane Isaias, unfortunately, for those on the East Coast, are moving gradually up the East Coast. It has created quite a lot of damage as it moves up. And then the other two tropical waves, one dissipated immediately and the other one is headed out in the Atlantic as well. So I'm happy to report, Governor, for about the next, hopefully, 6 or 7 days, it looks pretty open and clear for us here in Mississippi.
Thank you, Director Michelle. I just want to point something out. We get, obviously, we get daily data from Dr. Dobbs and his team at the State Department of Health, and they have done a fantastic job keeping up what has been very, very challenging times. We also get a weekly report from the Coronavirus Task Force out of Washington, and one of the interesting data points that they give that I have tried to watch over time is this issue of mobility, and that is what are people doing, and in terms of are you staying at home, are you going out, are you going to bars, as we know is problematic. And one of the things that's interesting to me is when this started, obviously we were at 100% level. By the time we got into late April, during our shelter-in-place order in our state, that had fallen to about 50% of normal. People were out and about moving, about 50%. We know that shelter-in-place at that time had a major impact. Now, most of that impact was undone around Memorial Day. There are different theories as to what happened at Memorial Day that made it different than every other day, but we don't have to go into that. But one of the things I'll tell you is we went into early to mid-July, that number had risen from that low of about 50% up to a number somewhere in the neighborhood of 92, 93%. People were going and doing, from a mobility standpoint, about 92% of what they were doing pre-COVID. The thing that we've seen since mid-July is that number has fallen to below 80%. And this is just one indicator that the people of our state are participating now. We are seeing less movement. We are seeing fewer people going out for social events. Dr. Dobbs said it earlier. How can we help? If we want to be good citizens and we want to help slow the spread of this virus, and quite frankly, if we want to take the initiative to not only participate in the statewide mask mandate, but we also want to help slow the spread to a point where it significantly lessens the stress on our healthcare system, what can you do? Dr. Dobbs said it. Don't go to funerals. Don't go to weddings. Don't have large gatherings at your house with 30 or 40 people to cook out. I know that's fun. I enjoy doing it. But if we could just for the next couple of weeks allow for those individuals that we know are confirmed positives, if we can just allow for them to self-isolate, and the rest of us can just only do what we have to do to go to work, to go to school if that's what your school chooses, and only do that. Stay away from large social gatherings. We would have a significant impact on reducing and slowing the spread of this virus. The 37 counties where we've had a mask mandate, where people have been participating, we're seeing a slowing of the spread. It's not slowing as fast as we would like it to slow, but it is slowing. And that's the challenge with this virus, is the things that we do today, we will see the benefit from them 2 weeks from now, maybe even 3 to 4 weeks from now when it comes to the hospital system. Because as you've heard me say, there are multiple iterations of what transpires once one individual catches the virus. And so I know that there are a lot of people who are in this room and are on the call who have questions. I know there are a lot of people throughout our state that have questions, and we want to do everything we can to get you answers, and just know that we are doing everything possible to get as much information out to as many people as possible. If we will come together as a state, we can slow the spread of the virus. We can see reductions in the total number of cases. We can make what's happened the last 3 days continue far into the future, and that'll be the best thing for our healthcare system. Understand, we are not ever in the next several weeks, possibly months, going to get to a point where there is no coronavirus in our state. That is not a realistic goal, and I cannot sit here and tell the people of Mississippi that that's what we're trying to do in the short run. What we're trying to do in the short run is everything that we can to protect the public health and to protect the integrity of our healthcare system. Our goal today is the same as it was in early March. Ensure that every single Mississippian that can get quality care actually gets that quality care, and I think we can accomplish that with the plan that is laid out today. Cordianne?
A two-part question, starting with Dr. Dobbs. I know that in recent days you have said that you would want to see schools delayed. Was it your recommendation that that be a statewide delay? And for Governor Reeves, what do you say to those parents, perhaps in, say, Corinth School District or some of these other school districts that are watching and seeing spread in these counties outside of the ones that are going to have the delayed start for certain grades?
Yes, sir. There's been a lot of conversation about this, and certainly there is some rationale for delaying in-person school a little bit if we can. There's a lot of complexities to that. I certainly understand it. If we look at what the recommendations are for when it's safe to start, we're not really there as far as like a percent positivity and all those sorts of measures. It's especially important that we consider delaying school for older kids, the middle schoolers and the high schoolers, because we know they're just as likely to transmit it as young adults. Also, we know how well they do it, right? So, but the younger kids also are more likely to benefit specifically from in-person learning. So part of it is a risk adjustment that we have to look at. If we can safely delay for a few weeks for an entire school district, that makes a lot of sense. Maybe we can beat this back. One of the main lessons, I think the points of this conversation is, let's just behave for a couple of weeks, right? Let's let our kids have got to get back in school, and just because we want to have a few beers with some friends from out of town, it seems silly that matters, but it matters. When we're calling people, it's family get-togethers, it's parties, it's not businesses that's doing it. And if it is like in a bar or in a restaurant, it's when people get together because they have 10 people that want to go out and have a good time. It's not the restaurant's fault. It's because someone brings it there. So it makes sense to delay where we can, but please, let's just all behave as best we can for a few weeks, and we can get this school thing back on track.
And what I would say, Cordianne, is first of all, thank you for that question. What we see is roughly 2/3 of our school districts do not plan to start prior to next week under the plans as they currently exist. Within those 2/3 of school districts that plan to start next week or later, which is 8 to 9 days from now or later, many of them, even though their school year is starting next week, that doesn't mean that they're starting with full classes that are going to be there next week. I'll give you an example. I look at some of these plans whereby they are saying we're going to do all virtual until September the 1st or through Labor Day, and then we'll either consider it or then we'll go full time. I look at a school district like Lafayette County School District, where they actually have a hybrid schedule that they're going to do, in which they are going to do an A-B in-person schedule. That means they're going to have 2 days of in-person per week per child. So one child comes in Monday, Tuesday, in person, and they learn virtually the other 3 days of the week. Another child comes in on either Wednesday, Thursday, or Thursday, Friday, and they learn virtually the other 3 days of the week. What does that do? Well, it guarantees that every single classroom has only 50% capacity. And so that's a plan that is innovative, that is well thought out. You've got others, like, for instance, the Lauderdale County School District has a similar plan with an A-B in-person schedule until at least August the 17th. If I were running an individual school district, what I would do is, if I had plans to, and by the way, my thoughts on this have evolved a bit. When I saw initially that the Madison County School District had decided to delay in-person class until Labor Day, my initial thought was, that seems like a bit of overkill to me. But now that I see that we're turning over in many indicators and that we have a chance here to really slow things up, what I would tell you is that that's intriguing to me now. If I were running a school district and I had the ability to not open schools until August the 17th, which is what I have done on these with the very high case counts, particularly if I'm in one of those 37 counties that already had a mask mandate in place, because clearly that's where the transmission is at least for the last 6 weeks, has been the highest. I would try to delay in-person schools until August the 17th. Having said that, I believe that there is no doubt that pre-kindergarten through 6th grade can attend school starting tomorrow in a safe way. I do think that you look at some school districts, and I'll mention Gulfport here, for instance, that have very extensive safety measures in place for their entire school district. They spend a great deal of time. In fact, they've spent the last 5 months at the Gulfport School District, and I commend them in trying to find safety measures. So while they currently plan to start with a somewhat traditional plan, certainly they have taken immense cautions to provide for the safety of their students. This is an issue that we are going to be dealing with. There are those that I think that some are on the call, some are watching throughout this state, that see this as a yes or no issue, that see this as black or white, that there is no gray area. The reality is this decision, and quite frankly, where we find ourselves in the world today, everything is a gray area. The decision we're making today could change a week from now. Is that going to make it hard for parents? Absolutely. No question. And I know that. But we are in an ever-evolving situation in which we are trying to manage two potential, and I would argue, two current public health crises. That is the public health crisis that is the virus, and the public health crisis that already has a scenario in which a large number of our kids in Mississippi have gone 5 straight months, longer than any of them have ever gone, most likely, some of whom have not learned much at all the last 5 months. And so we've got to find a way to balance the risk, recognizing that there is going to be some spread of the virus, recognizing that the risk to those under the age of 60 from the coronavirus is much different than the risk of those over the age of 60, unless, of course, there is pre-existing conditions or comorbidities, and we're just going to have to deal with those on an individual by individual basis. I think that school districts should strongly consider, particularly for those in 7 through 12, amending their plan to reopen 8 to 10 or 12 days from now. Give us the time for this, hopefully for the number of cases to decline. But I believe that the people closest to the actual classrooms are better equipped to make that decision at this time than I am. I also see other school districts that say, well, we're just going to do virtual learning for the entire year. I don't think that's going to work. And as we progress over the next several weeks and see what happens in some of these counties that I did mention, we will certainly make decisions with respect to them on literally a day-by-day basis. Follow up?
So does that have any impact on those schools and those counties that are set to just go virtual without seeing the order? Is that just really impacting those who were planning to go in person?
Yeah, so we are more or less, I think, by the way, that every person in every school should have had an opportunity over the last several months, and a lot of them have, to learn, to catch up, to do the things, say, okay, here's what we were supposed to learn virtually March and April. A lot of us tried. Some of us got it. Some of us didn't. And so what can we do to catch up? And so there is absolutely no prohibition of virtual learning, of teaching, of catching kids up. That's critically important. It's something that we must do. And we know that the first several weeks of school, maybe even the first month and a half of school, every year is catching up on what those young folks have forgotten over the summer. It's the reason in many industrialized nations around the world, kids go to school year-round. It's the reason, by the way, when we talk about Corinth, and particularly their planning, for all intents and purposes, the Corinth Public School District, because they have autonomy, they are basically a year-round school. They take large number of breaks. They take a couple-week break here, a couple-week there. But they more or less are in school year-round because they believe that is what gives their kids the best opportunity for success long-term. Renee.
Jackie with WHBQ has a question.
Well, I have two questions. So what was the driving factor behind finally issuing the statewide mask mandate? And would you consider implementing a fine if you have this mandate out and people are still saying, oh, it's not enforceable, people can't make me wear this? Would you consider something like that? And I have a follow-up.
Sure. Well, thank you for that question. What I would tell you is what I've told everyone on this call since early March. If your question is, would I consider, it doesn't matter what comes after that. The answer is yes. I have considered a lot of things and actually have done a lot of things in the last 6 months surrounding this virus that I never thought I would do. But I would certainly consider anything if I believe that it helps us make progress on slowing the spread of this virus and getting us back to a more normal life. That is what we as a country are so divided now, politically and otherwise. But the one thing that I think even all 3 million Mississippians can agree on is we want to get back to a more normal life. What I'm trying to do is lay out a roadmap by which we can do so in the most expeditious manner possible, understanding and realizing that we are dealing with issues that no one in this country has dealt with in well over 100 years. And I'm not even sure, given social media, that the 1918 pandemic comes anywhere near to this with respect to the role that public officials have played in that particular pandemic. So, yes, sir. I'm sorry, she had a follow-up.
Yeah, I have a follow-up.
Sure.
Okay. So what do you tell people who say that you should have implemented this mask mandate a long time ago? And why did it take so long to make this decision?
Well, what I would tell them is thank you for your opinion. It's certainly everybody has an opinion on every one of these issues. And what I will tell you is I believe that the manner that we have prescribed has been the best way to get the most number of people participating in our joint effort. And that's what it is. It is a joint effort. I can write words on the page all day long, but it's going to take all 3 million of us recognizing that here is a path for us to get back to a more normal environment as expeditiously as possible. Is at this point, as we have an opportunity, if everybody will participate, if we'll not go to social gatherings, if we won't go to funerals, if we won't go to weddings, if we'll just slow down for the next 2 weeks, if we'll wear masks and socially distance, if we won't show up in bars at 10 o'clock at night and stay until 3 o'clock in the morning while doing things such as inviting, which keep us from being disciplined about the other issues that I mentioned, then we have a chance now to, at a minimum, see a plateau, but hopefully actually see declining cases in the coming days and weeks. Yes, sir.
Dr. Dobbs, yesterday I was talking with a Harvard professor of global health, Dr. Ajish Jha, and he mentioned that Mississippi has the highest number of COVID positivity test rates at 22% in the so out of the nation. He mentioned that it's possible, because that number is so high, we're missing 1/5 of all COVID patients in Mississippi. What are your concerns on that?
We're definitely missing a lot of COVID patients. I mean, there's been a lot of studies that between, we're only getting like maybe 2 to 12. I mean, for every COVID case, there's 2 to 12 for every one. So that's not surprising. There's been a lot of discussion about the positivity rate. One of the reasons the positivity rate is so high is, well, there's numerous factors. I mean, one of them is there's a lot of people who have it. And so we have had less testing over the past week or so. But you remember, testing dropped off back in May, at the end of May. And I'm hoping, because when there's demand, there's demand. The other thing is we've seen, which has been pretty curious, and hopefully we're not doing this so much, is we had a lot of people retesting too. And so that'll actually impact our positivity rate, because we had people who were waiting on a test, and they came in and got a test somewhere else while they were waiting on that first test. And we also have a lot of people getting retested to go back to work, and hopefully putting an end to that. So there's a lot of factors involved, but there are absolutely a lot of people out there who have it that we haven't tested because they have mild symptoms or no symptoms. That's just part of the disease, and that's one of the reasons why we have to pretend like everybody has it all day long. Anybody you see, I'm pretending like you have it when I'm around you. So we need to do that with everybody.
Follow up on that, do you think it'd be wise to just ramp up testing even more, or do we even have the capacity to ramp up testing even more?
Ramp up testing, so most testing is done in the private sector, right? And so we are supporting additional testing without a doubt. But a lot of it's going to be free market stuff. So we're trying to increase our capacity, but our capacity covers a very specific slice of response. So we are supporting increased testing. Certainly we got more test machines going out to nursing homes. We are also seeing a lot more antigen tests or rapid tests going out. Expect to see a massive increase in the number of rapid tests that are available in Mississippi over the next month or two. So there will be increased testing, right? But that's going to be in large measure because of the free market trying to get testing out there for folks who want it, and then we'll increase our capacity and have been increasing our capacity for the outbreaks, for the nursing homes, for our mobile testing sites. So it'll continue to grow.
Let me preface my remark on this by saying this. Our test positivity rate is too high. Let me say that again. Our test positivity rate is too high. We know that. And so, having said that, when we talk about test positivity rate, I think it's important to know that to look at where we are today and compare to where we were last week or 2 weeks ago or 3 weeks ago, it is critically important that one understands that you are looking at similar data. In other words, as the number of rapid tests come online and are at certain facilities that either A, we are unaware of, or B, they are not reporting all of their negatives, or they're just reporting their positives, or in some instances they're not reporting at all, gives you a very skewed idea. So when I think about test positivity rate, the number that I look at is the number that we are given by the Coronavirus Task Force out of Washington. Why, you may ask? The reason for that is simple, because there are a set number of labs that report both positives and negatives to the task force every single week. And so if you have a set number, my understanding it's about half of all actual tests that occur in Mississippi. But if the numerator is the same and the denominator is the same in terms of the total number of testing labs that are involved, then you actually can then compare it from 1 week to the prior week to the week before that. That's just simple 6th grade math. In fact, my 3rd grader might even be able to figure that out. So when you talk about test positivity rate, and particularly this notion that, hey, we're going to go pick these red states and decide how they're doing based upon the data today, and we're going to ignore the data last week or 2 weeks ago, just understand this. When you look at diagnostic test positivity rate in Mississippi, last week we were actually at 14.8%. The region as a whole, as defined by HHS, was at 13.6%. So our test positivity rate, yes, was higher than the region as a whole, but it is not significantly higher, or at least I would argue it's higher at the margin. And so if you're looking at test positivity rate based upon total number of tests and today's, for instance, number of new cases, well, that is certainly not garbage data, but it leaves a lot of unknowns, such as when was the test actually administered and when did we actually get the results. Now, in talking to Vice President Pence and the Coronavirus Task Force yesterday, I am told, with the exception of one lab, and by the way, it is a major lab, but with the exception of one lab, they have worked through their backlog over the last 2 or 3 weeks. And so by and large, most private labs now are 2 to 3 day turnaround time. 2 to 3 days is too long. To Dr. Dobbs and his team's credit, their return rate has been at about 24 hours throughout this entire time, and I give them credit, and I give the public health lab credit for that. But most private labs now are about 2 to 3 days, which is where we were back in March, April, May, and June. Now, there is one lab that's still 5 to 8 days getting test results. A lot of them were at 10 to 12 days, by the way. A test that is administered today that we get results 12 days from now really doesn't do anybody any good. It doesn't do any good because 12 days later, the high likelihood is that you're no longer contagious even if you had it. That also, by the way, is one of the reasons I presume that Dr. Dobbs and his team issued their order today, which says if you have a positive test, you need to self-quarantine, and it is the law of the land that you do so from a public health perspective. So there's a lot of data that one can look at. I don't know anybody in this state, at least, with the exception possibly of Dr. Dobbs and his team. I don't know of anyone that doesn't work for the Department of Health that spends more time looking at this data. It seems like for the last 3 or 4 months, I spend about 90% of my day doing it. And while I'm not real proud of that fact, I wish I had other things that I had time to do. That is what I spend a lot of time on. And so, again, the key about data is being consistent and understanding what you're looking at. Yes, sir.
Good afternoon, Governor. William Owens. My question is, we were just talking about schools being delayed in several counties. Is this something that's going to apply to both private and public schools?
So Mississippi and really the State Department of Education and ultimately the governor through executive order sets the schedule for public schools. And so just as the shutdown in March and April of our schools applied only to public schools, this order will only apply to public schools as well. Now, I will tell you that back in March and April, the vast majority of private schools actually adhered to the order. But again, every single school has a unique set of facilities, and the local leaders, generally speaking, know better than I do as to what their facility abilities are. Yes, sir.
Yes, this is the governor and Dr. Dobbs. You mentioned football earlier, Governor. State's football crazy. Mississippi private schools are set to open their season next Friday night. What's that, 9 days? And then the public schools, September 4th. do you see any way that, you talk about not going to social gatherings, can we have football games that soon?
What I would say is this. We haven't made a decision on an executive order as it relates to high school football. Here's what I can tell you. I've had extensive conversations with our university leaders as to what college football may look like, and I think it's interesting to point out that the Southeastern Conference has said there will be no college football games until September the 26th. The one thing I want to be sure, no one likes high school sports and college sports more than I do. I want to make sure everybody in the state understands that I am going to prioritize the education of our young people first and foremost. I believe that there are many sports in high schools that can be played a week from Friday night. I do not envision any scenario in which there can be a large crowd in the stands to watch those football games.
Yeah, so would strongly advocate against having crowds in stadiums. I mean, there will be some risk for the players, without a doubt, but there aren't a lot of 65-year-old people out in the field playing football. But there's a lot of folks out there vulnerable in the stands, and also would promulgate transmission in the community. The current executive order, as I understand, is 25% capacity, right? But I would say that it makes a lot of sense for the stands to be mostly empty for the benefit of the school and for the community.
Jack, Learning Ledger has a question.
Yeah, I've got a question for Dr. Dobbs. You know, a few months ago, the Department of Health executed a plan to test every worker in resident long-term care facilities in Mississippi. Is there a similar plan for students and teachers in the school systems? What is the plan for testing students and teachers in Mississippi?
So if we look at the orders of magnitude here, so the plan for the nursing home and long-term care folks was to test all the nursing home residents and the employees. That was 30,000 people. It took all of our teams 2 weeks to get it done for 30,000. So it's not plausible for us to do that for all the kids getting back to school, right? It's just not doable. The other problem that we have, so for the nursing homes, we've been going back and forth and testing the employees and the residents over and over again where the outbreaks are. And so it's been a huge investment. And there's an effort to test every employee every week. So you can imagine that it would be impractical for a lot of reasons to do that many folks over and over again. The other challenge that we have is that a test does not mean that you're not going to have it the next day or the next week. So it's not a solution to the problem. The solution to the problem is to prevent transmission and not get it in the community. What we will be doing, as we're able, there's 1,200 schools in the state of Mississippi. There are 3 doctors upstairs in my office, right? And we're working diligently to try to make sure that when we have an outbreak, like, if we have, in Corinth, they did not catch it in the schools there. I just want to reiterate. I'd like to clarify, there are 6 students, only 5 of them were actually in class. And so we're still looking into that. And we're going to help with outbreaks and testing and try to help them work through it. But if we open up a whole bunch of schools and we have, say, 1,000 outbreaks, that's going to severely limit our ability to assist in outbreak response and testing. So we're going to be in outbreak and response mode and help with advice. We've been working with docs in the local community to help them guide their schools on what to do and then to use their local private resources to do testing where we can. And so we'll be there to support the school systems in any way that we can within the resources available to us.
I would just like to add, because I have not had a conversation with Dr. Dobbs about this specifically in the last 2 days as we've been focused on public schools. What I envision occurring, by the way, the testing of the 27,850, if I remember correctly, residents and employees of the nursing home that began over a 14-day period in late May, in my opinion, has had significant impact on reducing the total number of lives lost from this particular virus. The reason I say that, if you go and you look from May 1 to June 15th and look at the percentage of fatalities that were caused by COVID-19 that were actually in nursing homes, and it is a very, very high number. If you look at the percentage tied to nursing homes in the last 6 weeks, it is actually significantly lower than it was in the 6 weeks prior. Now, that's not anything to be excited about. We're still seeing way too many fatalities, and part of the reason that that data is correct is because we're seeing more fatalities in the general public. But the testing in nursing homes matters because we know when you look, for instance, at those under the age of 50, the fatality rate is 0.2975%. That is about, give or take, probably a little bit lower than it is with the common flu on a bad flu season for the year. However, when you look at the fatality rate of those over the age of 70, it is significantly worse than that. And so it is critical that we invest time, effort, and resources in the long-term care setting. It is my view, and it is my belief, and it is what I have asked from the administration, that we are going to see more rapid tests flow to our nursing homes. If we get more rapid testing in our nursing homes and our long-term care facilities in Mississippi, we can then take our testing resources and our testing apparatus and focus them in other areas. In addition to that, I have asked Director Michelle and our great men and women at the Mississippi National Guard to redouble our efforts on testing, and I would hope that within a very short period of time we will significantly increase the number of support personnel that we have to provide for additional testing in our state. Now keep in mind, we're in the middle of a pandemic. Unfortunately, the legislature decided to cut Dr. Dobbs and the State Department of Health's budget this year. They cut the governor's office budget, and they cut a lot of budgets that are responding to this pandemic. But we are working very hard to make sure that we focus our resources in a way that gives us the best chance, A, to slow the spread, and B, to minimize fatalities. Yes, sir.
This question is for Dr. Dobbs. Going back to your emergency declaration for people that tested positive for COVID, making sure that they isolate themselves and stay at home, in what way could you actually, or could this be enforced to make sure that those that tested positive actually are staying at home?
Yeah, so there's a couple things to this that are going to be useful. So we want a foundational order, and we're trying to use our medical community to give the information and link for education on how important this is and what it means. We are looking at hiring an additional team of private contractors to do additional case investigation for us, that they could use the same mechanism to inform the individuals. As an example, this is stuff that we do for other diseases like tuberculosis, and we do enforce it. If someone is egregious in their behavior and it's putting the general public at risk, we do file a petition with the local judge and get the sheriff and do the whole 9 yards. I don't think that that's going to be, a likely scenario with much frequency, but if someone's was just diagnosed and they decide they're going to go to some big event and they say, by gosh, I don't care, I'm going to cough on everybody, we probably would do something about that.
Renee.
Thank you, Renee. I have a question for the governor, and if I may, a quick follow-up to Dr. Dobbs. Governor, the American Academy of Pediatrics has generally been very supportive of the need to get kids back in school, the same things you talk about, education and social needs. But the Mississippi chapter said it should require at least a 2-week trend in positive case numbers improving. We're not seeing that, more than 1,000 today. So considering that, how close did you come to actually delaying the start of school statewide, or were you always bound and determined to move forward?
Well, thank you, Dave. You've probably known me long enough to know that when I make a decision, that I'm steadfast in it. However, I think you've probably also watched me over the last 6 months and know that I've tried to be humble enough to recognize if and when we have made the wrong choice, and then go and do everything I can to fix it. Look, there are a lot of great pediatricians in our state, many of whom are great friends of mine, and they look at this from what they view as a perspective. And what I would simply tell you is I'm forced to weigh every single decision and try to take into account a myriad of exceptionally challenging data points. And so what I would tell you is I did not make a decision on what to do with respect to today until late yesterday, after having reviewed 598 pages of school reopening plans. Look, the easy thing would be, well, let's just delay it, and if a few kids get left behind, then so be it. But you know what? Those few kids that get left behind, I'm afraid in our state it may be tens of thousands of kids that would get left behind. And I can't do that to those 10,000 kids, put them in a position in which they may never recover for the rest of their life. And to me, that's what this is about. There are no easy decisions. It's certainly not anything that I ever envisioned that I would be here talking about. But I believe, I firmly believe that this decision today gives our local schools options to do what's best for kids. And I'm hopeful that those who cannot open safely will delay the reopening of their schools until at least August the 17th. And quite frankly, as we look a week from now, my advice may be to not reopen until August the 24th. But for those schools who have a plan where they can implement the guidelines that have been initiated by CDC, by Dr. Redfield, by the State Department of Health, and by the recommendations by Dr. Dobbs, I believe they ought to have the ability to do it. And look, as was mentioned earlier, we're going to learn a lot from Corinth. We're going to get to see a lot from what happens in Corinth. And again, and this has been the issue the whole time. So one's viewpoints and one's, I would just say, not political as in Republican or Democrat, but geopolitical perspective certainly plays into this. But one way at looking at the situation that's currently going on in Corinth is there are 6 positive cases, 5 of whom actually attended class. Oh my gosh, we ought to shut everything down. The other way to look at it is, okay, there were 6 positive cases. There were 5 kids that attended class. The administration did the right thing. They contact traced. They figured out who they came in close contact with. They have isolated them, though they won't come back in the classroom for 14 days. Meanwhile, the hundreds and hundreds and hundreds and hundreds of other kids that did not come in close contact now have the opportunity to continue their learning and hopefully catching up from what they missed in the spring of last year and perhaps in the summer. And so there's no easy answers and no easy solutions, but I believe that this decision is the best thing for all Mississippi kids.
Dr. Dobbs, what are your concerns with school-age kids in terms of contracting the virus, developing medical issues in a school environment, and what are your fears in terms of them being spreaders or vectors, threatening teachers, parents, and other family members?
Yes, as we've discussed several times, we know that younger kids and young adults are unlikely to have severe illness. So that's great. They're unlikely to. It does happen. There are severe illnesses and there are deaths, but by and large, most kids recover quite nicely. Younger kids are probably less likely to transmit the virus than older kids. We're still learning, but that seems to reflect reality right now. But it's the spread issue, right? It's to the teachers, it's to the community. Is it going to, it's just like with when we saw the 20-year-olds and we said it's not going to stay in the 20-year-olds and we watched it for a couple of weeks and it went to older folks and it got in the nursing homes and we saw our mortality rate increase. Same sort of thing, it's just a different age cohort. So we need to be very careful about how we approach this such that we minimize or eliminate, when possible, transmission in the school setting, understanding that high schoolers and middle schoolers are going to be more likely to spread it just based on the biology of the scenario. But our protocols within the school system are going to be very important, because if we can keep that spacing, if we can keep the masks, if we can maintain as much sort of order within the way that we educate our kids, it's going to be important. Our biggest vulnerabilities are going to be the same thing they are in healthcare. It's going to be those times when we let our guard down. It's going to be during athletics. It's going to be during band. We are looking at an outbreak in a band camp. We're still looking into it. It's going to be these scenarios where people are not social distancing because the situations are not equipped to handle social distancing. It's going to be the break room. It's going to be when people eat meals. Anytime you let your guard down and take your mask off is going to be a time when you're at risk.
Sarah Ulmer with Field Politics with a question.
Hey, Governor, just curious, how will this order affect private schools in those areas? And kind of a follow-up question to that, for schools in these counties that will be suspended, if they had already had plans to do virtual learning starting next week, will that learning also be suspended until the August 17th date?
Thank you for the question, Sarah. It will not affect non-public schools, and as I said earlier, I encourage distance learning every day. In fact, I wish we could do distance learning 5 days a week, 52 weeks out of the year. And so while it may affect their number of days, and that's something that we will work on with the State Department of Education, it does not affect their ability to teach kids virtually if, in fact, that will work. Yes.
Dr. Dobbs, I know that we had talked about this a couple of weeks ago, but particularly with schools starting back, I think the question will come back up more about retesting for either returning to school or work. Once you've tested positive, what is the kind of threshold? I think people will be asking a little bit more.
Yeah, sure. So we still recommend 14 days of home isolation if you're test positive or if you think you have coronavirus, right, while you're waiting on your test. Do not retest. We know that your test will stay positive for months even, and your virus is gone. The test actually finds the genetic material, and the genetic material sticks around longer than the virus does. So if you want to cause a lot of consternation and confusion, retest. But if you want to be efficient and make sure that you're safe, just follow those 14 days and make sure that your symptoms are better and no fever, and go back to work, but do not retest.
Nick June with Jackson Free Press has a question.
Great.
Hi there. Dr. Dobbs, you called Corinth High School a model for the state to follow. My understanding is that 91 students and staff members are currently quarantined after the very first week of school. That trajectory would make the entire school virtual only in a matter of weeks. If that's our model, won't that be replicated everywhere in the state? And I will have a follow-up.
That's a great point, because it reflects the community, not the school. These are kids who walked into the school with coronavirus, and that they were able to find it quickly and quarantine those kids is great. Now, it's going to be tough. That's why it's such a challenge to start school right now, because if you're having to quarantine such a big segment of your school, it's going to be hard to educate. So we're learning as we go through this, and that's one of the reasons why it makes a lot of sense to delay school and do virtual now for those who can make that happen, because it's going to be a challenge. Even if you do everything perfect, you're going to have to impact your operations for that reason, and others, and because there will be some transmission inevitably.
Well, but Alcorn isn't even on the list of places to delay. So if that's the model and it's in a relatively low transmission area based on this list, I mean, is that the best case scenario? Because again, that's almost 100 students in week one. Yeah. And
it's the best case scenario for the response. They've been really good about knowing where the kids are and who to quarantine. And we're learning as we go. And so as we test all these contacts, it'll be good for us to understand how effective those prevention measures are.
Hunter Dawkins with the Gazebo Gazette has a question.
Thank you, Renee. Thank you, Governor. Quick question for you, Governor. I know you don't like to speak about Washington, D.C. politics, but I'm going to be brief on this. This Saturday is supposed to be the end of the Payment Protection Program, which from national news sources that the CEOs of a few large companies have sent letters to Congress. My question is if anyone from your Restart Mississippi Task Force has spoken with you about something involving this matter, and also, I mean, since this is the trial for small businesses, and because of the mask mandate and because of some of the schools delaying their opening periods, where do we fall in that from a small business perspective?
Well, thank you for that question, Hunter. I will tell you that we have now been in this press briefing for just shy of an hour and 20 minutes. If I were not, and I anticipated that, and I'm going to try to answer as many questions as I can, if I were not on this particular call, it'd be likely that I would be on a call working on the legislation that is ongoing, the conversations and the debate in Washington, D.C. That's something that I think is important. Obviously, small businesses are critical to the future of our country, and they're critical to the future of this state. When you look at revenue losses, there was a report that came out over the weekend. You look at revenue losses and economic activity by state. Mississippi's in far better financial shape today than virtually every other state in the nation. A, because we planned for this. B, because we had a rainy day fund that was full, 10% of our annual operating budget, and I'm pretty proud of that. And also because we did responsible budgeting during this year's budget year by and large, with a few exceptions, obviously. But it is important that the initial payment protection, the PPP program, that the Congress enacted that. I appreciated that they enacted it. And I think it's important for small businesses that we continue to look for ways in these unprecedented times to make sure that we, and this is the whole argument, right? This is the whole debate, is we've got to develop strategies that not only protect the lives of Mississippians, but also protect the livelihoods of Mississippians. And if you're a small business owner, and I know because I've grown up with one my entire life, if you're a small business owner, your livelihood is in that small business that you operate. And we got to do everything we can to minimize the risk and, quite frankly, the hardship and the pain on those individuals, just like we got to do everything we can to minimize and mitigate the risk of the spread of the virus.
Allie Martin with WCBI has a question. Allie?
There we go. Is that better?
Hey, Al, I can hear you now.
Hey, Governor. Yeah, I want to talk about the economy in the middle of the pandemic. On Monday, Ashley Furniture announced a $22 million expansion in Northeast Mississippi, and other corporations have announced big projects throughout the state. What does that say about the confidence that companies have in Mississippi in the middle of a pandemic, and how could that impact November? There's an election coming up in November.
Well, thank you, Allie. I appreciate that question. I mentioned earlier that I spend about 90% of my day scrubbing over data as it relates to the coronavirus. I will tell you, I spend the other 90% of my day working on economic development in our state, and I will tell you, I'm exceptionally, and I want everybody in Mississippi to know this, I'm exceptionally optimistic about our economic future. We have got to manage our way through the coronavirus, but companies are interested in investing in Mississippi today, unlike anything we've seen, I believe, in my lifetime. We have a workforce that is interested in learning and growing their skills, and we can significantly improve our per capita income in our state through smart job creation efforts. And I could not be more proud that the Wanick family and Ashley Furniture has decided to invest millions of dollars in Mississippi and hire more Mississippians. It's a really big deal because they already employ thousands and thousands and thousands of our citizens. So they know what our workforce is like, and they're investing in us. And I am exceptionally pleased by that. We're happy to have them as a partner, and we look forward to growing. As it relates to the election, look, we're coming out of a very difficult economic time. Second quarter numbers were bad. We all know that they were bad. And so we've just got to decide as a country, do we want to vote for the economic policies that led to the great economic expansion of 2017, 2018, and 2019 under President Trump that were only foiled by a virus being released from China? Or do we want to go back to the failed economic policies of the 8 years prior? To me, that's the choice in the election. If I were advising the president's campaign, that's what I'd be talking about every single day. And that's what I'm going to talk about because I think it's important.
Senator with Mississippi today has a question.
Hey, Governor, this question's for you, but perhaps Dr. Dobbs could also weigh in. Dr. Dobbs recently made the comment that there's nothing magic about August, and he really he also made the comment that, quote, it's crazy. Consider thinking about going back to school this week. The State Medical Association, others have urged pushing back to September. Why not follow their advice? What is it about getting started back to school this month as opposed to waiting until September?
Thank you, Jeff. I appreciate that question. It is my view that we can put our kids back in school in a way as defined and described in those 598 pages of school restart plans that make sense. We have parents that are exceptionally interested in some finality and to the extent possible on when kids are going to be back in school. And quite frankly, it's the same answer that I kept giving back in March and April about why can't we just do a shelter in place. And the reality is that there are going to be some, not all, but there are going to be some that a week from now or a month from now, there are going to be other reasons that we shouldn't reopen schools. And I believe that we can do it in a safe way. I think that schools that do not have good plans in place, and look, the administrators that sent plans in that just said we're going to do it like we've always done it, they ought to delay their school start date at least until August 17th and probably to August 24th and actually develop a plan to make sure that kids make sure their plan looks a lot more like the vast majority of plans, which I believe put kids in a situation in which they can be protected and the teachers can be protected as well. So I think that there's a lot of opportunity here. We have what I would view as a staggered open date. Certainly if all 500,000 kids were starting school yesterday, that would concern me even more. But we have a date over the next 4 weeks in which different kids are going to school in different school districts in different settings, and we're going to monitor it very closely. And like I said, this is the beginning of the conversation. It's not the end. We know that there are going to be cases in schools that we're going to have to deal with every single day. I can tell you from my personal time commitment, if no school was open for the next 6 months, I could probably spend a lot less time on coronavirus. But that's not what's best for kids. We know it's a public health crisis. If kids stay out of school for 9, 10, 11, 12 months, and we just can't allow that to happen in Mississippi. Are there risks? Sure there are. I'm aware of those risks, and I still believe this is the best decision for our state.
Eric Walker with WJSU has a question.
Yeah, this question is more for, I guess, Dr. Dobbs. So Dr. Dobbs, can you elaborate a little bit more on your thoughts and opinions as it relates to post-secondary education? I think I heard you say, if I heard you correctly a little bit earlier, you're more concerned about, I guess, about bars as it relates to colleges and universities. Why do you think that colleges and universities are a little bit, I guess, less risk than elementary and high schools?
Well, we spent a lot of time talking with the colleges and the junior colleges too, and community colleges. We know that how to be safe, right? I mean, it's the spacing, it's the masking and that sort of thing. And the plans that I've heard from the different colleges, the blend of online learning and limited in class with spacing, they have a lot of resources for in the classroom safety that is actually a lot easier to achieve than younger kids, especially much younger kids. If we look at where the college-age kids are getting coronavirus, it's at the party, it's at the fraternity house, it's at the rush party, it's at the bars and that sort of thing. So we have to work on different strategies to protect the college kids. Frankly, it's going to be extremely difficult. One of the things that's kind of new since I came through is that a lot of the kids live there year-round, right? And so they're already there doing all that same sort of stuff. So it's just a different set of challenges. The risks are not so much in the classroom, they're outside the classroom, primarily.
I think it's important to point out somewhere in the neighborhood of between 90 and 98% of Mississippians have been working nonstop for the last 6 months and have somehow managed to not contract the virus. We're not seeing significant spread in the workplace. We're not seeing significant spread in those scenarios in which people need and quite frankly have to engage themselves. And so the simple fact that we are going to see kids back in school, if we'll do the little things like wear masks, stay socially distanced, and those kind of things, we will not see significant and massive community spread going over the next several weeks and months. Hopefully, the plans that are in place, and having talked to many of the same people that Dr. Dobbs has talked to in the community college and the senior college area, they have plans in place where it is very achievable in the classroom that will occur, and we're going to have to deal with the nightlife as we progress forward. Yes, sir.
Governor, the state of Mississippi rose to the occasion, as it were, at the very beginning of the virus. We developed our own in-house type of resuscitators, breathing apparatus at the university level, at Mississippi State, at University of Mississippi Medical Center. We developed our own. Are we anywhere closer to developing a quicker test, COVID test? It seems that professional sports has that ability. You know, they know within minutes, it seems, prior to a game, that certain players are testing positive. Is our money no good? Do they have better scientists than we? I mean,
most professional, I'm reminded of a cartoon that was done, this was years ago after Eli Manning got his first major contract. There was a cartoon done by someone who still lives in Mississippi with Eli and myself. I was state treasurer at the time, and it was basically someone saying, hey, now Eli has more money than the entire state of Mississippi. I'm sort of reminded of that based upon this question. There's obviously large amounts of resources by our professional sports franchises. But the good news is the Abbott Labs test, the Roche test, the other tests are increasing capacity. They are increasing production. My understanding is we're going to get, as a country, as many as 2 million a week of those rapid tests. We're going to deploy them mostly to our nursing home settings because that's where the most vulnerable population is. That's a decision being made by the administration, but one that I support. And so as they are continuing to increase capacity on the manufacturing of those rapid testing machines and the stuff that goes with it, because you can't having one and not the other does you no good. We will have an ability to do more rapid testing, particularly around nursing homes and particularly around the employees, because if we are in a long-term care facility in which there are 100 patients and we test all 100 patients and none of them have it, If we can make sure no one comes into the facility that has it by rapid testing the employees, then we can do a pretty good job of protecting those 100 individuals.
Dan Gallo with MSNBC has a question.
Hey, Dr. Dobbs. Thank you all for taking my question. I know we've dealt with your comments this week a little bit during this. I just want to give you one more chance to kind of clarify a little bit more of the comments you made about school districts planning to have traditional school being, quote, crazy and unacceptable. From what I've heard today, this plan just doesn't really seem to square up with what you were suggesting this week with the delay of starting schools. And, a lot of parents will hear these plans and might be wondering if you and the governor have read from the same page as far as, the school districts and what their plans are. So has something changed? And are you still concerned that this could end badly by not delaying all schools?
Yeah, so of course everything has different levels. As far as starting traditional school in the near future, I think it's nuts. I mean, we can't have unmitigated risk as far as the schools go. Now, by and large, most of the districts have planned pretty thoroughly, some more than others, as far as what they're going to do. There's also levels of risk. Certainly for high school and middle school, you're going to be a lot higher risk. I'm supportive, and we're supportive of delaying school until the background community transmission rate is lower. But do understand that especially for our youngest kids and maybe kids with learning disabilities, there's a lot more urgency of getting them in the classroom. We've got to take this seriously. To be quite honest, I think some of the plans could use a lot of work as far as making sure that we do mitigate class sizes and mitigate proximity and those sorts of things. We still have a lot of people who are very fixated on extracurricular activities. And if we don't take it seriously, we are going to pay for it. It's just inevitable. This virus has taught us over and over again that we can't let our guard down and pretend like it's going to be okay because of some new mythical miracle that's going to help us out of it. It's going to be the boring, laborious, simple things that are going to help us out of this.
Jack has another question.
Governor Reeves, throughout this pandemic, we've seen you stress the responsibility of individual Mississippians before coming back later to issue an executive order because people were not following your recommendations. First with that lockdown order, now with the statewide mask order. Some may see this as giving deference to local folks, but others are going to see this as passing the buck. Your own state health officer just said that a lot of the plans from school districts could use work for their reopening. You're the leader of the state and you're recommending that schools without comprehensive plans should delay until August 17th. Why not lead on this issue and just make an executive order that reflects this?
Well, thank you, Jack, for that question. What I would tell you is this. The initial supposition that you made with respect to both the shelter-in-place order and the mask mandate was totally and completely false and totally and completely wrong. In fact, I chose not to issue the shelter-in-place order early on in the virus, and as we look back on it, it's because it gave us an opportunity that when we did issue the shelter-in-place, we were able to do it for a very short period of time, for only 2 weeks, or just over 2 weeks. People complied with it. People in our state, or really across the country, cannot be locked up into their homes for months and months and months on end because they've got to provide for their family. They've got to be able to put food on the table for their family. The same is true of the mask mandate. You believe that I've issued it today because evidently you're not listening, but you believe that I issued the mask mandate today because people were not adhering to it. Wrong. Absolutely wrong. It's false. The reason we issued the mask mandate statewide today is because I believe that a large number of Mississippians are actually participating in slowing the spread of the virus. They are doing exactly what we've asked them to do, and I'm proud of that. And we need to look at the fact that our numbers are down. I don't know why, but on the front page of your newspaper today, I didn't see anything written about the only 650 cases that were reported on Sunday, the 550 cases that were reported on Monday, the 1,000 cases that were reported today. Again, all three way too high in only 3 days, but literally a 33% decline in total number of cases compared to the same Sunday, Monday, Tuesday time frame of approximately 1 week ago. You don't write anything if it's even remotely positive, and that's okay. I get it. That's not what sells papers, and a lot of times y'all are only interested in selling papers. I'm interested only in getting the vast majority and the most possible Mississippians to do the best things possible so that we can slow the spread of the virus. That's all I'm focused on. I issued my shelter-in-place order at the exact opportune time that I believed it would have the most impact. I issued this mask mandate today statewide because I believe this is the exact time it will have the most impact. As we are talking about opening schools, as we have seen a slight decline in overall numbers because people in certain counties and throughout the state have started wearing more and more masks, I believe right now is the time to say for a time certain, if everybody will buy in over the next 2 weeks, it will make a huge impact on slowing the spread of this virus, and I believe that'll have a huge impact on protecting not only the lives of Mississippians, but also protecting the livelihoods of Mississippians. You know, it's interesting. There are a lot of people that get to sit back, they get to watch, they get to say, you know what, if he had just done this 6 months ago, if he had just done that 5 months ago, then all would be good. Well, look, there's going to be a lot of time for Monday morning quarterback, and we do a lot of that in Mississippi too after college football games. But the reality is there'll be time enough for grading all of us 6 months from now or a year from now. My decisions are in real time based upon what I believe is in the best interest of Mississippians. And that's what I was elected to do, and that's what I'm going to do.
Bobby Harrison with Mississippi Today has a question.
Governor, I didn't think I had any questions that had not been answered yet, but just following up on your last statement, I mean, I guess I'm confused on why is the time now for the statewide mask mandate? If it had effect in the counties you enacted the mandate 2 weeks ago, why it makes sense to me that it would have had an effect statewide if you proposed it 2 weeks ago. Like I said, I didn't have any questions left until your last statement. So just time on that.
Well, thank you. I appreciate that, Bobby. And here's the answer. There are those that believe, in many instances, they come from a legitimate place. They believe that when government says jump, 100% of the citizens say how high. But that's not how it works in the real world. That's not how it works in the real world. If I thought 5 weeks ago when I issued my first mask mandate for, at the time, I believe it was 13 counties, that a larger percentage of Mississippians would wear a mask for months and months and months on end, if I just did it, then I would have done it. That would have been the easy thing to do. I can tell you, poring over data all night long, every night, and making decisions based upon what the data says and picking this county and that county, the piecemeal approach is a lot harder than just saying, statewide, here's what we're going to do. I hope y'all do it, and knowing that that's not going to be the case. The reality is we are dealing with a scenario in which when we write the words on the page, we need to do it in such a way where there is trust and confidence by the people of our state that we're doing it for the right reasons so that they can maximize participation in our mandates. That's the reason that I've done what I've done today. It's the reason I believe it's the right thing to do. I am convinced that we had a large number of Mississippians participating in our mask usage, both in counties where there was a mandate and in those counties where there were not. I believe that today, seeing the numbers and the fact that we are beginning to turn over, and that if we are at a point now where if we can get more and more people to stay away from funerals, it's interesting to me that every question I get is about a mask, which is one mitigation effort, but we need to do all of these different mitigation efforts together. We need to wear masks. We need to socially distance. We need to not go to social gatherings at each other's homes with 10 or 12 or 15 people. We also don't need to go to funerals. We also don't need to go to weddings. Those things that a lot of us want to do, but it's just not smart to do right now. I believe, and I appreciate what all of y'all have done, by the way, in covering this pandemic over the last 6 months. I'm sure we've all learned a lot more about the history of viruses than we ever imagined. And if we can get the message to enough people across this state that we have a chance now, if we're smart, to continue to do the right things, and it will make a difference. And the thing that's hard about this virus is the things that we do today, it's 2 to 3 to 4 weeks out before we see any significant impact or effect. It's just reality. And so the number of new cases that we're going to get tomorrow when the Department of Health releases their data, they're not new cases from today. They're new cases from 3 days ago, or maybe a week ago, or most likely 2 weeks ago when somebody got it and then contracted it and then handed it off to somebody else. So again, I want to thank all of you for being here. I have a 4 o'clock and it's currently 4:15. So again, an hour and 45 minutes of good questions. I hope at a minimum, very honest answers. We have challenges before us, but the fact is we've got to protect the lives and the livelihoods of all Mississippians, and we have to protect against the risk of the virus and also the risk of kids not being in school for months and months and months on end. So to all of my fellow Mississippians, thank you for joining us today. Stay safe out there, and God bless.